an LM podcast hosted by the American College of Lifestyle Medicine. I'm so glad to have you here with us today. First, I'd ask you to please introduce yourself to the audience.
All right, thank you so much for inviting me. I was very excited with this invitation. So I'm Teresa Da Cunha, and I am just finishing my fellowship at University of Connecticut. I'm finishing my GI fellowship. So I did all my residency and then chief year and GI fellowship at UConn. I'm originally from Portugal, though.
Excellent. Thank you so much. And least importantly, I am Josie Ford. I'm a third-year medical student at the University of Connecticut. So go Huskies.
Go Huskies.
So just to get us rolling with the podcast today, I'd like to hear first, who or what brought you to lifestyle medicine?
Yeah, that's a great question, actually. It was one of my very close friends and also colleague. She's a rheumatologist right now. And when she introduced me, it was about a year ago, and she was a fellow at the University of Washington, Rheum fellow. And I had never heard of lifestyle medicine before, but I quickly digged in and had a look at what it was about, and it really aligned with my way of thinking about medicine. So it was a very quick, kind of establishing and knowing that I wanted to be part of this curriculum and this board. So that's how it all started.
Awesome. And do you mind speaking on your experience pursuing the board certification in lifestyle med?
Yeah, for sure. So I heard about it a year ago, so like July of 2025. And at that time, I was starting my second year of fellowship, my third year of fellowship, right? My final year. And then I thought, if I wanted to do the exam, it was going to be right after the conference. The conference is in November. And so I had a few months to prepare. I didn't know how hard the exam was and all the expectations. And so I tried to talk as much as possible when I went to the conference, to different people, and to this colleague that was doing rheumatology that was also interested. She had a lot of information about it. And then I also had to kind of talk with my program director because, we have our scholarly activities, part of our fellowship. So I had to kind of make a balance between the two. And it actually worked out pretty well. What I did was I bought the book on lifestyle medicine, kind of the board certification book to prepare us for the exam. I read the whole book. And then there's a nice question bank, part of the board that was also very nice to prepare. And so I kind of read the book. There's several chapters that go according to each pillar of the lifestyle medicine curriculum. So I tried to do like one chapter a week kind of. And I also, because there's the online component, it was very helpful because I was hearing the whole thing on my, way to work, coming back home. So that kind of helped consolidate the whole thing. And then I went to the conference in November, which was in Dallas, and I really loved it. And then like 2 weeks after the conference, I did the exam. And so, like any exam that we take with a lot of multiple choices, I thought, damn it, I'm not going to pass the exam. But then I passed it. And I think the book, the board preparation really prepares you well to have like a good kind of base knowledge on lifestyle medicine and what is important. So that's how it went.
Good. Thank you for walking us through your study process, and congratulations on passing the exam. What an accomplishment. What advice would you give to another doctor in training or person in the healthcare field in training who's in a rigorous training program and considering pursuing the board? Because credit must be given to you for doing both at the same time.
Right. No, I think there, so when I was thinking whether should I do it during fellowship or after, I don't think there's ever going to be a good time, you know? And I think it's such, if you like lifestyle, it didn't even feel it as extra work because it's really rewarding to get this knowledge. And so it was almost like, oh, now I'm more curious about lifestyle medicine than GI, you know? But they come along pretty well together. So it was actually kind of complementing what I was doing in GI. So I think I don't think there's a good time to do it. I think you just have to do it. And if you don't pass the exam, I don't think it's a big deal. You do the next year. There's obviously costs with it, and hopefully, my program, they have a stipend for each year for scholar activities, so they were able to cover the costs. But I think, just do it whenever you hear about lifestyle medicine. I think that's when you should start digging into it.
Awesome. I like the attitude. And that segues us perfectly into how do you practice lifestyle medicine professionally, and what pillar do you find yourself promoting most often?
Right. So, I mean, another great question. I don't think right now, where I am in fellowship, it's not that easy to practice lifestyle medicine the way I would love to do. The main reason is, I have my own clinic. It's a half day of a week of my own patients. So that's the opportunity I have to counsel my patients on lifestyle medicine. And obviously, the problem is always the time constraints, right? So we have 30 minutes to see each patient. A lot of them are new patients. And so just gathering all the history, going through their GI issues, and doing the lifestyle, which, should 100% be incorporated in every visit. I just think it's such a new approach for the way we've been taught throughout the years during residency medical school that I don't think I, I don't think it's the best way to do it. So, but the way I do it right now, it's I tell my patients, I'm board. I always tell them I'm board certified in lifestyle medicine. Not everyone is, and so I have this approach of always giving the option for my patients if they want to know more about it. So I don't tell them right away that that's how we're going to do. I tell them, there's guidelines from GI and there's lifestyle medicine that I became certified recently, and I'm happy to talk about that to you if you're interested. And I've never encountered a patient who is not interested in knowing more about it. And so I end up, I mean, I know that all the pillars affect the GI tract, but I end up talking more about nutrition, and it's kind of, a little more natural way. A lot of patients come with, bloating, constipation, so it ends up being the most common pillar that I end up touching. Um, and so, if the patients say they want to hear more about it, I always save 10 minutes to really try to have it doesn't have to be through medications. Actually, the data shows that if you do these lifestyle changes, it's going to be beneficial not only for your GI tract, but it can affect, every single organ, basically, every single system. And I offer them, do you want to just do this way first, or do you want to complement, or do you want to talk about it in another visit? So that's how I put it together.
I really like how you gauge the patient's interests and then tailor your approach and give them options. And your lifestyle medicine interventions just complement the GI field so well. So that's a really nice clinical practice that you can employ. And how will that translate into attending life for you? I know you're about to start your first attending job.
Yeah, that's a great question. So I'm moving south, more to Florida, and I don't think or at least the practice that I'm joining, which is a private practice, they don't have anyone doing lifestyle. So I think it's going to be an excellent complement for this practice. And I already have some idea. I think with lifestyle, the shared medical appointments are very important because I don't think 15 or 20-minute appointments are enough to educate patients on lifestyle, right? It's such a change to what it's normal these days of how we are living these days, which is very different from what's good for us. And trying to tell a patient on how to change their eating habits, it can't be in 15 minutes, right? They need to understand why it's good for them. So I think what I'm going to try to implement, first I have to establish myself and know my patients, but I'm going to start offering them the option of doing shared medical appointments if they are interested. And so I'll try to do maybe a 1 or twice a month session with the patients that are interested. And because I'm doing GI, I'll incorporate these into diseases such as like fatty liver disease, irritable bowel syndrome, idiopathic chronic constipation, and try to gather patients in groups according to their most significant symptom, and then try to do the lifestyle sessions with these shared medical appointments.
So amazing to hear, and it sounds like you're truly going to be pioneering for this practice. And good on you for bringing the lifestyle medicine into this clinic that you will work in. Did lifestyle medicine come up during your interview process and your job search?
So actually, no, I think there's still very little knowledge amongst the GI world about lifestyle. And so during the interview process, it wasn't something that was highlighted. But then when I finally took this job, then I, rapidly wanted to understand if this could be accommodated to do what I wanted to do. And they were very happy, they don't know about it, but we have to go through the billing and everything, and it seems like everything can work. So I think it's going to be, I think it's a great addition for any private group to have some sort of lifestyle medicine incorporated.
Yeah, absolutely. And branching off of that, what do you think needs to change in our healthcare system or in any given practice to allow lifestyle medicine to become more mainstream?
So I think this goes back, to young kids and the way we grow up. I don't think it's just the health system. I think it's society in general, right? If you go to a daycare right now, they're feeding toddlers nuggets and like snacks coming out of like highly processed foods. And so I don't think it's just the healthcare system. I think changing the healthcare system, just the healthcare system, it's not going to be a solution. So I think it really needs, obviously, as healthcare providers, we have a big impact on how we're modeling, how health should be exemplified. But just going back a little bit, I'm European. And so when I came to the US, for me, it was a big shock to see how differently the food was here. So everything is extremely tasty. The portions are huge. It's very normal to eat donuts and muffins. And I didn't grow up like that. And so I think that also made me more interested in the lifestyle medicine component, because I see patients who have no other their reality has always been this, right? They have no other thoughts on, how does it look like to eat a little healthier, not even healthy, just healthier. So I think at some point I'm seeing some shift of providers being more aware of, even though not everyone knows about lifestyle medicine, I think there's this big trend also in social media about health and lifestyle. And so I hope that at some point the shared medical appointments become more of a norm, because we can't do much in 15 minutes that will change the lifestyle of patients. So right now, I think the shared medical appointments would be a huge change for the system. I think the patients they come to us because they really think that we are the ultimate solution for their problems. So they really trust our recommendations. And if we're not touching on lifestyle medicine, they are not going to know, right? So there's no one else for them to go and, teach them about these things. So if the doctor is not telling them, then they're not going to make any change. They will assume that, if they're constipated, they need the laxative and they should continue with their lives the way they've always done, without moving, without eating fiber. And so I think it needs to change. It's the mindset of the healthcare providers needs to change. But obviously, it's going to include also a lot of the insurances and all the privacy part of doing these shared medical appointments. But my really hope was that by changing how schools, like government-based, like like the school food and what normalizing a good diet instead of continuing with the processed westernized diet.
Yeah, you're so right that the built environment that we live within shapes our perceptions and understanding and experiences with food, and it just becomes ingrained. So, all the more reason to have healthcare providers that are knowledgeable and have the tools necessary to be able to share their knowledge with their patients.
Right. And I think some medical schools are already incorporating the lifestyle curriculum. And so I think, there's going to be more physicians with a different mindset. So I think that's going to help as well. I just always think that the time constraint of our visits will always be a barrier to make significant changes to patients' habits.
I agree. And shifting gears a little bit, another reason I was so excited to have you on the podcast is because you've not only studied lifestyle medicine and used it in the clinic, but you're also studying it from a research lens. So, can you tell the readers a little bit about your scholarly work in lifestyle medicine?
Yes. So it's not very extensive, but I've always enjoyed doing some reviews in GI. And so when I got exposed to lifestyle, then I wanted to do something lifestyle related and have not just to put it out there, but also for my own knowledge, like something like inflammatory bowel disease, which, it's not considered functional at all. It's a real pathology with real histology, and, inflammatory markers and everything. So I wanted to understand how does lifestyle medicine impact inflammatory bowel disease, and I couldn't find any extensive review on it, but there are several studies that touch different pillars of lifestyle medicine and how they impact the course of inflammatory bowel disease. Most of the studies are on Crohn's disease, and there's pretty good data, on you can go through every single pillar and there's good results on outcomes on these patients. For instance, with nutrition, there are randomized controlled trials on how a Mediterranean or a whole food diet for patients with Crohn's disease who have mild to moderate disease can achieve remission. A lot of these are in children. There's also now a few in adults as well. But I, for me, it's like, why aren't we doing this? Why are we just offering medications and not talking about, and until a few years ago, if a patient would ask about diet and IBD, we would say, oh, there's no data on diet. You can just keep doing whatever you're doing. But there's more and more data And I think as physicians, we have the duty of offering the patient what the evidence shows, and giving them the option, because it's okay if they don't want to do it, but there's a lot of people that will want to do it. And so that's my review. So it focuses on like how nutrition has these very good results on, and even if it's like moderate to severe disease, there's no study showing that you can go in remission, because I think it's also very hard to do such study because these patients are very sick. But it does show that in the long term, for maintenance of their disease, in combination with biologics or other advanced therapies, it does provide excellent improvement in inflammatory markers, overall quality of life, symptoms. So it has a big role. And this review is actually just got accepted to the Journal of Lifestyle Medicine. So if anyone is interested, it also covers micronutrients, which also play a significant role, physical exercise, even sleep and stress management, smoking. So it was something that was very rewarding to gather all the data out there and put it into a review.
Well, we'd like to extend our congratulations to you for your publication, and good on you for collating all that data and presenting it for researchers and clinicians to have it all in one spot. I'm sure that will be powerful, and hopefully also spur researchers out there to do more studies on this topic. It's amazing to hear that there's already data that exists in the treatment naive patients and patients who are also concomitantly using a therapeutic. So really fascinating, and we'll have to keep an eye on you to see what you publish next.
Yeah, let's see what my schedule is going to be like, but I'd love to.
Fair enough. So now, because a lot of our audience of this podcast are trainees in medicine, I'd love to ask, what skills or experiences during training do you think are most helpful or important for integrating lifestyle med into future practice?
So first of all, obviously, it's familiarizing yourself, getting involved with the lifestyle medicine college, because even though I've always been, mindful of, health and physical exercise and nutrition, I think the American College of Lifestyle Medicine does an excellent job for us physicians to make it very evidence-based, and helping us to how to counsel our patients, how to actually make lifestyle medicine prescriptions. So I don't think I would ever be able to do it without the lifestyle medicine certification, because we always assume, the patient knows how to eat well, or the patient knows what exercise is, but they need specific prescriptions, and we need to be able to counsel them with evidence-based data. So that's the first thing I would say. It's really getting involved, even if you're not board certified or not do the boards, but just going through the either the book or all the resources available from the college. I think it's very important. And the other thing, I think, you have to also yourself be someone who follows lifestyle medicine. And so I think if you incorporate the changes in yourself, as much as we think we're already doing better than our patients, if we really look into it, most of us aren't. And when we kind of get into the shift of trying to go through what the evidence shows, and we feel better about it, I think it's also easier for us to counsel our patients and do the lifestyle prescriptions.
Yeah, and that's a great point, and it makes me curious, how do you practice lifestyle medicine, and what's your favorite pillar?
Okay. So I I think it's hard to have a favorite pillar. I think the hardest pillar for me is sleep, and I think that's where I was not doing well. And lifestyle medicine really made me think, okay, I need to sleep more, because I would always, try to stay. I have three little kids, so trying to stay awake after they're in bed to be more productive. But it really like this lack of sleep really impacts the day. And so right now, that's my favorite because it's the one that I was not doing well at all. Uh, but but also with three little kids, I'm very focused on nutrition. And it's been actually lifestyle medicine made me cook so much more and enjoy cooking, which is
Nice.
something that before I was always, rushing in, like have to feed a whole family. But now it's actually enjoyable because I'm thinking, oh, I'm so lucky to be able to provide all these nutrients to my family, and enjoy the meal as a family, and actually thinking about the meal more of a nutrition, like something that is providing us nutrition than just a meal that we have to eat.
Hmm?
And then physical exercise. I've always done some physical exercise, but I made it into a routine since I've got exposed to lifestyle medicine. So no excuses. That's what I tell my patients when they say, oh, I don't have time. So I ask them, what time do you wake up? Or what time do you leave the house? What time do you wake up? And they have their schedule, and I say, well, if you wake up 20 minutes earlier, you're going to have 20 minutes of exercise. And if you're going to bed a little later because you were on social media for an hour, then just put in something to block, to restrict that time in social media, go to bed 20 minutes earlier, and maybe you're going to have 40 minutes of exercise. You can make the time. And so I also put that into myself to be able to do 20, 30 minutes of exercise every day.
I like it. It sounds like it's touched almost every aspect of your life, which is really inspiring and great to hear, as a trainee, and I'm sure for those listening as well. I just want to open the floor for you if you have any last comments that you want to make, that we didn't get a chance to touch on yet, and if not, no worries. But just want to give you the floor.
Oh, thank you. I think my advice, I think it's great that the lifestyle medicine word it's bigger and bigger. And I think I wish as a resident I got exposed to lifestyle medicine, because I think it's gonna help with the crazy schedules that we have. If we do prioritize our health, we're all gonna feel better. We're gonna provide better for our patients as well. So we can inspire our patients just with our own experience. So, I would say if you're a resident now and you're busy, try to take a couple of minutes of the day to look into lifestyle medicine, because I think in the long run, it's going to be one of the best things you can do for yourself and your patients.
And making that change in yourself, your passion for the lifestyle med suggestions you're making to your patients will just shine through and hopefully help to motivate them more.
I hope so. I hope so too.
All right. Well, thank you so much, Dr. Da Cunha, for joining us today and for making the time. We really appreciate it. And I know that you'll inspire others. And you're truly a pioneer in your clinic and in the field of GI, to join this lifestyle medicine movement. So thank you.
Thank you so much for having me. It was really a pleasure, Josie. Thank you for taking your time to do it as well.